Minister, Last Count Corla, I wish to second the motion as proposed by my colleague Deputy Kelleher. In doing so, Minister, I bear you no ill will. I don't. Minister, I am contributing to this debate on behalf of the Fianna Fáil Party, but also in recognition of the mess that the government have made in recent days and recent weeks of the delivery of health service in this country. I don't want to personalise it, and it shouldn't be personalised as it being entirely of your fault. But we only have to take ourselves back, and I can best speak for what happens in the constituency that I represent. But if we take ourselves back 2 years, take ourselves back prior to the election, I'd be happy to deal with any issues that you might have in due course. Happy to deal with that. And Minister, you came to County Clare. The Taoiseach, as he was, or as he is now, he was then the leader of the opposition. He made some very firm commitments in relation to the delivery of health service in the County of Clare. He talked about the retention of medical services at Ennis General Hospital. He talked about the retention of cardiac services at Ennis General Hospital. And in recent days and weeks, the HSE have brought forward specific comments, and they have recognised that those services will not be maintained. And the best that you have been able to do is provide your two local deputies with a letter, a very firm letter we understand from them, saying that no decision has yet been taken. When their colleague, or our colleague on the Labour Party, is saying he's aware that it's going to happen, that the medical services that was promised to be retained by Enda Kenny, leader of the opposition, are now to be taken from Ennis, and that the cardiac services that have been part of the service delivery mix are to be taken in due course, we understand, not immediately. Now, what I want to know from you, Minister, is what has changed significantly in the delivery of health service across the country that requires you to make those changes? Changes in terms of the position that you adopted prior to the election. As far as I'm concerned, Minister, two things have changed. One, you're now the Minister for Health. The leader of the opposition, as he was then, is now the Taoiseach. And the HSE have been abolished by you. And there's still an effort being made by your backbenchers, when they go on local radio or comment in the local paper, to somehow suggest that the big bad HSE are responsible for all of this. My colleague has already outlined the position that you took, and it's well known. You forced out the Chief Executive of the HSE because you didn't like what he was saying. You got rid of the corporate governance that existed, the independent board, the independent chairperson. So you now have effective control. And it's hardly then fair that you should somehow dump on the frontline managers and the frontline staff that happen to be part of the delivery of the health service and try to suggest that they somehow are the people that are foisting these dreadful decisions on the people at large. I was part of an administration that had to accept that services at Ennis Hospital had to move through the reconfiguration process. And I did, because they were in the best interests of patient safety. But I never hid behind the HSE. I never hid behind, oh, we don't have the money, someone else caused the problem. I stood up clearly, unfettered, and put it forward because I thought it was the right thing to do. Now, Minister, will you do the same thing? Will you give your backbenchers in my constituency and the other constituencies the wherewithal to explain the tough decisions that have to be taken? That it's not a budgetary issue, if it's not a budgetary issue. That if services have to be reduced in a particular area, it's from a patient safety point of view, or it's in the best interest of the patient. If that's not the case, and if it doesn't stand up to the clinical views of the doctors, well then say that. Say it's a budgetary issue. Say that you have prioritised some other aspect of public spending, and that there are some other areas of public spending that are more important to your administration than the services that you're reducing in the particular hospitals. But don't try to hide behind, as your colleague beside you has, somebody else caused all these problems and we're there to clear it up. You still have a commitment to deliver an effective and a required health service to the people of this country. You're now making those choices. They're not being made by people with independent of the political system. You have accepted control and you're taking that control. But also ask you, Minister, to explain a couple of things. In opposition, your party talked negatively about the reconfiguration process, particularly in relation to the removal of acute surgery from the smaller hospitals and where it was centralised to the tertiary and the main hospitals. And as part of that negative political campaign, your party supported certain catch cries along the lines, if these services are removed, if the bypass protocols are put in place, in the case of Ennis General Hospital, 20 people per year will die. Your backbench colleagues put posters in their windows advertising that fact. Well, now, Minister, I want you to answer a couple of questions in relation to that particular campaign. If there was truth, if there was validity to those arguments, then since you've come to office, 33 people have died in the constituency that I represent. If there was truth or validity to that statement, 33 people have died. What have you done to correct that? What have you done to row back on the decisions that led to those deaths? Now, I don't believe that 33 people have died, Minister. I don't believe that it was a wrong decision to reconfigure the surgical services. So then can you, in copper fasting my view, the benefit that you now have of sitting in the Department of Health as the chief bottle washer, can you confirm that that was political rhetoric on behalf of your colleagues, and that you fed into that on a daily and a weekly basis in this House, and that the Leader of the Opposition, the current Taoiseach, fed into that when he came to County Clare and to other counties, Roscommon, Sligo, wherever, and he fanned the flames of fear in the minds of the constituents throughout the country.
8 minutes left.
And for that reason, I'm objecting to the approach that you're taking. And there was a wry smile on your face and on your colleagues when I first said that I don't bear you any ill will, and I still don't. But my support for a motion of no confidence in you is aimed at the government and the outrageous and cynical approach that you took for the weeks and months in the run into the election in an attempt to buy it, and you didn't need to. The public had lost faith in the last government. They were going to vote for you anyway, but you couldn't get over which of you were going to be Taoiseach. Was it Enda Kenny? And you have Nina Hospital to deal with now, and you made some fairly important commitments there. But yourselves and the Labour Party were trying to outwit each other. And the ladder wasn't high enough on a daily basis for you to climb, to wave the next slogan, regardless of what it did in undermining the good people that work in the health service. You just couldn't resist the temptation to undermine what was and is a good service, with problems and with issues that need to be resolved. But you fanned that flame on a daily basis. You tried to hoodwink people. You capitalised and attempted to capitalise on the genuine fears of people. For many elderly people, for many people with sick children, for many people with a compromised immune system, their biggest worry is, will there be a bed there the day I need it? And in your case, you saw that strain, you exploited that weakness, and you captured a considerable amount of support on the back of it. And it's right now, Minister, that you would be made answer for that, and answer in this House in an open and clear way. And I don't like throwing the old political stuff over and back. I want to stand up for the patients that I represent and for the people that I represent. And I want you to explain to them how things have changed so dramatically in the number of months in between, and how things have resolved themselves from your perspective, that it's not as bad as it might seem, and that it doesn't impact on people's lives in the way that you presented it. And Minister, I'll sit and I'll wait and I'll listen to what you have to say. And I have never been afraid to stand up and support tough decisions. And if you want to continue in that vein, I'll have no problem supporting you with a reconfiguration process that's centred around the delivery of a quality healthcare system with the patient front and centre. And if that's a hard one to explain politically, I've history in doing it.
Just 5
and
minutes.
I went before the electorate and they accepted me for it. So now it's dependent on you and your backbenchers to show a small bit of backbone and stop hiding behind the facts and come out and tell the truth.
Come out, Deputy